Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. It's a beautiful Friday afternoon, November the 27th, the day after Thanksgiving. And so this is our chance for us to talk to you and for you to get questions that we can hopefully answer. I'm going to take my mask down as I'm the only one in the room here. This is one of the very easily available, what we're called procedure masks. They work pretty nicely. I still have never quite gotten used to it though, so we'll go without it. So again, Dr. Bob Dannenhoffer, the Public Health Officer, Douglas County. If you have questions, put them in the chat section and we'll get to them. We have also had some questions on the Facebook questions at douglaspublichealthnetwork.org. So we'll see if we can go ahead and get those answered first. But let me go through where we are with the disease in this country and in the world. It's still a very, very active pandemic. 61 million cases in the world, 1.4 million deaths. Cases in the world are rising, but starting to flatten off. But deaths are still growing now at 10,000 a day. The places in the world where it's active is U.S., India, Brazil, Italy, Russia, Germany, UK, and France. However, when we look earlier in the week, the U.S. and Russia were the only two of those countries that still had an increasing rate, and India, Brazil, Italy, Germany, UK, and France all had decreasing rates. And the number of cases in the U.S. was equal to the number of cases in India, Brazil, Italy, Russia, Germany, and UK. So still a lot of cases, and we in the U.S. still have the bulk of the cases. There are three countries that I've always been sort of interested in. Canada, because it's close to us. They had on October the 12th, they had Canadian Thanksgiving. So our Thanksgiving is in the end of November. Theirs is in the first half of October. And what they saw was a rise of cases leading up to their Thanksgiving, and then a sustained rise thereafter that they have attributed to family gatherings and others in Canada. They're still just now, we think, coming to the peak, but they've had some deaths that followed all of these celebrations in October. And that's why we're worried a lot about Thanksgiving in this country. We also have been following Israel. Remember, Israel in September had a big increase, and now they're starting to come down. Sweden, where the Swedes took a slightly different approach with less restrictions early on, with the sense that if they got through the cases early, that later on they'd have fewer cases. Well, it has not worked out for them, and now they're having lots of cases, and they've enacted not a lockdown, but enacted restrictions similar to those restrictions in Oregon, say, in the U.S. The other one that we carefully look at is Israel. So Israel, Sweden, and Canada, and each of those, I think, give stories that gatherings are a problem, and that lockdowns like they did in Israel really do seem to work. You know, the rest of the Central Europe seems to be having a declining number of cases. The goal being they want to get the cases down enough so they can have a somewhat normal Christmas, because Christmas, obviously a big holiday in Central Europe. In the U.S., we're at 13.3 million cases, 269,000 deaths. I think any of the numbers from last week and this week really need to be taken with a grain of salt. There was a lot of differences in last week and this week in terms of how much testing was done, what testing was done for. So there was a lot of asymptomatic testing before people wanted to travel. Not something I'm a big fan of, but that's what it is. And we think that some of the places where people might get tested when they're sick, like urgent cares and doctor's offices, were mostly closed yesterday and today. And so it's really hard to know. It's really hard to know about the testing positivity and the total number of cases. Nonetheless, still lots of cases in the U.S. I'm looking today, even on this day after a holiday, and it looks like it'll be over 150,000 cases today. And again, spread throughout the country. The biggest number of cases in the middle part of the country, Illinois, Minnesota, Wisconsin, the Dakotas, Nebraska, really a lot of problems. But there's almost no place in the country which is cooled off except for Hawaii. Hawaii is pretty cooled off. Vermont is pretty slow, but the rest of the country clearly has some activity. Now, Oregon has, the fifth lowest state, one of the lowest activity states. Douglas County, less activity than the rest of the state, so it's hard to believe that we're in one of the better counties in one of the better states, and we're still having as much disease as we're having. In Oregon, we've had a record number of cases over the last 2 weeks. Again, I would take the number of cases in the last 2 days with a bit of a grain of salt. The two things that I'm pretty sure of in Oregon is deaths. They are now starting to trend up, in hospitalizations, which is probably the firmest number, right? Because we get that number within a day, so there's not a lot of delay in it. And if you get hospitalized with COVID, typically means you've got fairly significant symptoms. So we are worried that Oregon actually has its highest number of hospitalizations, well over 500 today. So that's a worry. In Douglas County, we're still seeing lots of cases. Again, we had a low case count today, but again, that may be because we're now getting our tests back so quickly. So these were represented tests that were done yesterday, and we don't think there were very many tests done yesterday. We did a lot of testing today. We did 35 today at our drive-through, and so there are quite a bit of testing being done today, but we'll see what happens. But I think I really worry that people did gather over Thanksgiving. So one of the ways they did that is I took a long walk yesterday. I noticed there were a bunch of houses that had a bunch of cars around them. Ooh, that suggests there's a big family gathering of more than one household. Sometimes with 4 or 5 cars, you'd have to guess a gathering of 4 or 5 households. And the concern is that some of those, not the majority of them, not most of them, not a majority, not even a big minority, but just a few of those need to be super spreader events where one person was sick but had no symptoms, and they spread it to 10 or 15 others. If we even have 100 of those over the next week, it means we'll have 1,000 cases in the next week. That would be a staggering number of cases, and I hope it doesn't come true. We are dealing now with a number of big outbreaks. Remember, in Reedsport, we had the Halloween party that led to lots of cases. We're still now seeing cases in Reedsport, but it's really hard to track where they come from. So Reedsport, that previously had very, very few cases, is now having lots of cases. There's a big outbreak at Curry Manor that is continuing to show cases and sicknesses. There are 2 church-related outbreaks. That's a problem, and there's an outbreak at another nursing home down south. So we have now multiple relatively large blazes going at once. And you can imagine, if you're fighting forest fires or house fires, if you have 5 big blazes going at once and hundreds of little blazes, it's really, really hard to figure out where the fires are coming from and to have enough people to put them out. So we really do worry about that. Let's get to some questions. Can I explain the number of tests on each day's update? Folks are trying to estimate the rate of positive tests based on daily numbers. That is going to be hard-ish because the number that the state calculates is a little different, and you can't calculate from just the numbers we have, but it'll be pretty close. So if you take the number of positive tests and then the difference of the negative tests from one day to another, you'll get sort of a sense of where we are on that. So the state in the last week changed the methodology they were using from one perfectly acceptable methodology, which is actually most acceptable for a short outbreak. So back in January and February, we didn't know how long this was going to last, and so Oregon and other states picked one of the methodologies, which was great for a short outbreak, but now that the outbreak is really long, we're needing to switch to a different format. And so our rate of positivity went down and most counties went down in the last week. I think the new number is pretty reasonable. What you're going to do is you're going to go ahead and be able to get our weekly positivity rate. If you go to the OHA site and look at the school metrics, you'll be able to see our positivity over the last 2 weeks, and that's where I would get the data from. So Veronica says, can you explain what a presumptive case is, please? Is it a household member of a case? So if you're a case, I have the disease and I have a confirmed case. It is people who are close contacts of mine who are significantly ill. Not just a little earache or headache or something. You have to be significantly ill with fever, cough, abnormal chest x-ray, shortness of breath, or a loss of sense of smell or taste. So you have to be a close contact of a confirmed case and significantly ill. So I did a bunch of case investigations this week. One person was a presumptive. One person was a presumptive out of all the areas. Either the family members around them were not ill or they were only mildly ill. So the only people get to be presumptives. You have to be a close contact of a confirmed case and significantly sick. Now, the number of presumptives, as you see, has always been about 10% of our numbers because some of the people who are presumptives choose not to get tested. So I did call one case yesterday, and the story was this fellow, his mom, and were both positives, and the wife was sick. Well, she said, I think I know what I got. So she wasn't looking to get tested. If she was significantly sick, she would be a presumptive and remain a presumptive forever because she chose not to get tested. I'm not sure if my wife and the other people in my house were all sick with known COVID and I was sick with it, that I would rush out and get a test. And that's what it is. So they don't have to be household members' case. They can be any close contact, but they need to be a close contact of a confirmed case and significantly ill. So Laura said, did our county get put on the governor's extreme high-risk category yesterday? So the high-risk categories are based on several factors, but one of which is the case rate per 100,000. So we have 111 or 112,000 people in the county. Our case rate is in the high 200s, so yes, we would be in that extreme risk level. You know, this is sad because really until Halloween, we were in the low or moderate risk level. And so to be in this high-risk level is really disturbing. And again, what we're seeing, it's these huge outbreaks. And each of these huge outbreaks have a clear start, and a clear start that was sad. Bill says, I read there was a study using steroid inhalers as a treatment with success. Is that true? I have not seen a double-blinded controlled study. Steroid inhalers may well help. Steroid inhalers are very safe to use. We don't think there's any side effect from steroid inhalers, and they could give some effect there. However, these have been touted now for months and months and months, and there have been a number of studies, none of which have been able to show lots of success. So I don't know. I don't have a big problem with you if you're already using a steroid inhaler to use it during this illness. Again, steroid inhalers are usually quite safe. So, are workplace outbreaks on the weekly report from Wednesday? Yes. And what makes a workplace outbreak? So workplace outbreaks are a little complicated, but typically they're workplaces that have 5 or more cases and they have at least 30 employees. So if you only have 7 employees at your shop, it doesn't get reported. If you have less than 5 cases, it doesn't get reported. Now, one of the problems with this is that people who are big employers, and say you have 1,000 employees in the town, when there are 200 active cases, you have 1/100th of the county population. And so since you have 1/100th of the county population working there, and there's 200 people who currently have the disease, wouldn't be shocking that you would have 2 cases. And so it's a little hard to know on the really big employers like Mercy and the VA and school districts and whatever, that they might have 5, but I'm not sure what that means. So what number of rapid tests that are negative end up having a positive after being sent for PCR? It is some, but not a lot. But we had one this week, which was very interesting. Someone decided that they wanted to get a negative test so they go to a big family meeting. They got a negative rapid test. They also sent a PCR. And just before they were leaving for their big family reunion, the PCR came out positive and it stopped it. So I'm not really a big fan of the test before you go strategy, either before you go to a party or before you travel, because of just this reason. You know, had the PCR not come back until Thursday night, this person would have spread it to everyone. Far better to avoid travel if you can and avoid big gatherings. We think it's about, a couple of percent of the rapid tests that are negative will turn positive with the PCR, so a few percent. So if you're symptomatic and have a negative, that's a good sign. If you're asymptomatic, these tests really weren't designed for asymptomatic people. So you do need to be careful and don't trust a negative test to allow you to let down your guard. Our guard should be up. So what are your suggestions for those of us who didn't travel or have family around for Thanksgiving and are going to work around people who did? Well, wear your masks, socially distance. I don't think we can change. I don't think we can change what other people do. So Veronica says, what do you think about the data on one of the new vaccines, now saying it's only 60% when it used to be 90%? So if your mind is boggled by the amount of data out there, you are not alone. There are 3 vaccines that have reported results. There is the Moderna vaccine and the Pfizer vaccine. These are the messenger RNA vaccines whose data got reported a few weeks ago. Those both had no safety signals, no other issues with the way that the trial was conducted, and had effectiveness between 90 and 95%. Those are the 2 that are going for FDA emergency use authorization in the month of December, and those are the 2 that we think we're going to get first. So that's the good news. Now, you also have a vaccine from AstraZeneca and Oxford University over in England. This is a different kind of vaccine. This is a vaccine which is based on a chimpanzee adenovirus that has genetic material inserted in it, which would make your body make the spike protein, and then you would make antibodies to the spike protein, and you do it. There are 4 enormous problems with this vaccine. The first is that it had some safety signals that the company has not been very forthcoming with about what's going on. A person in England had transverse myelitis. The second concern is that it was stopped in Brazil because there were some issues in Brazil. And so there are 2 safety signals which worry me. The third is that apparently when they gave some of the people the vaccine, somebody miscalculated the dose and gave them a half dose. That's really worrisome. You know, those of us who deal with meds will occasionally make a med error, not very often. I mean, I can't think I've made more than a few in the last 5 years. So to make this for 3,000 people in something so critical as a trial is very worrisome. And what's most worrisome is they didn't report it as an error back when they did it. They're just now saying they did it, and they're saying it was good luck. Well, it's not good luck. It was a medication error that may have resulted in good luck, but it was a medication error. The fourth thing that worries me a little bit about this is they have funny data on this. If you got a half dose first and then a full dose, it was 90% effective. But if you got a full dose first and a full dose second, it was only in the 60s or 70s. That makes like no sense at all medically as to what's going on there, and they don't have a good explanation. And so when you have data for which there's not a good explanation, you really have to scratch your heads and figure what in the world is going on there. And so that is worrisome. So my sense is, if you had to ask my best guess is that the Moderna and the Pfizer vaccine, which are the mRNA vaccines, will get approved in the next short bit. They'll be out by the end of the month. People should be able to get this in their arm by the end of the month, and we'll see how it goes. I think the AstraZeneca is going to engender lots of concerns about, the side effects during the trial, what to make of this funny difference in efficacy with a half dose versus a full dose, especially when you had more efficacy with a half dose than a full dose. That makes no sense. So we're going to see. Clarice says, how long after the 2 COVID shots will you be immune? We don't know, right? Obviously, we do know that you seem to be immune in the first month thereafter. Whether that immunity falls off afterwards, we don't know and won't know until the first year. They are going to measure antibody levels in these people. They seem to be high and protective, but we'll see if their antibody levels really fall off. And those people who were in the original trials are going to get reviewed again and again and again to see if they got the disease. So if the disease is 90% effective in the first 2 months, but then drops to 50 and then 40 and then 30, it may be that you need another dose. But we won't know that until the time comes out. So can I explain the side effects of the vaccine? We are hearing that you should take a day off work. Well, I've heard people say that. I don't really get where that comes from. The side effects of the vaccine from the mRNA vaccines seems to be very similar to the side effects from any vaccine. Achiness, maybe a little low-grade fever. maybe a little bit of overall feeling of unwell. I mean, I get a flu vaccine every year. I don't think I've even taken a minute off, so I'm not sure that you should plan to take a day off. However, we'll have to see. So when they release the things about this, you may want to know. So if like 50% of the people develop a fever in the day after, we obviously don't want febrile people at work. That will also then make a difference for how we do it, right? So if the story is that, yeah, most people feel crummy and miss a day of work thereafter, you wouldn't, for example, want to give it to the whole hospital staff on one day, because you get it on the whole one day. The next day there'd be nobody to work. So we're going to have to carefully see what the level of side effects were and the percentage. And that's what we need to know, right? Because let's say it is, yeah, 3/4 of the people couldn't go to work the next day, then you're really going to need to arrange these so that the hospital can keep working, the fire stations can keep working on the day after you get this. I do not think that's going to happen, though, but that's data we need to find out. And that's exactly the kind of data that should be widely available to those of us who are planning on the day before or the day of the FDA panel, because that's clearly going to make a huge difference in what we do. What would you like to see the citizens of Douglas County do to get the numbers down? Wearing a mask is a given, but it's political. So really, truly, the number one thing when I check with people who've had the disease or talk to people who've had the disease, they have had a close contact with somebody else outside their household without a mask. So they've had a contact with somebody outside their household without a mask. And so these are people at work who may use a mask all day at work, but then they go to break with somebody and they get sick, and they're around somebody at a break. They go to dinner with somebody who's sick. In the one case that I went over this weekend, it was somebody who was handing around cookies to people, and they weren't wearing masks because they were eating the cookies and showing how delicious the cookies were. And so it's that kind of thing that would do it. It's church services where people weren't wearing masks, or a party where people weren't masks. So it is gatherings with people outside your household without wearing a mask. I mean, wearing a mask is important in places like at the grocery store and whatever, but we don't think there's been a lot of transmission in those areas where you pass somebody in the aisles, or you get checked out by the checker. When they're wearing a mask, you're wearing a mask, there's plexiglass, and the whole checkout thing takes 3 minutes. That's not where we've seen a lot of disease. It again, so people who have it, sit down with a buddy, have lunch, sit down with a family member and have dinner. That's where we've seen it. So avoid gatherings with people outside the family where you're not going to be wearing masks. Now, you can't really wear a mask while you're eating. I mean, no easy way to do that. And so that would be the number one thing. So Jess says, how long are you immune after getting COVID? We assume 90 days. So the assumption is it's 90 days. With almost all respiratory viruses, you pretty much are immune for 90 days. But whether it's a little shorter than that, a little longer than that, or much longer than that, we do not know. Now, people have suggested it's, kids get it less because they have lots of exposure to things. But that doesn't exactly make sense, because certainly 6-month-olds don't have history of a lot of exposure to coronaviruses. So we don't know how long you stay immune. We're saying 90 days, but as things go on, it may get more. We are starting to see people who are now double dippers. They got the disease back in the springtime, and they got the disease again. So we clearly are seeing people who appear to be double dippers. And there's really good evidence in literature that there are some double dippers. And it's truly not just the first one that didn't go away. It's a different virus from the first time. So they clearly are double dippers. So Linda says, if you get a fever after the vaccine, could you be contagious? No, none of these are infectious. None of these will give somebody else the disease. So if you get a fever after the vaccine, you will not be contagious. You cannot give the disease to somebody else. Now, the problem is going to be, with a lot of disease around, let's say I'm exposed on December the 5th, and I'm scheduled to get my vaccine on December the 12th, and then on the 12th I get a fever. Did I get the fever from the vaccine, or did I get the fever because I was brewing COVID? And I don't know the answer to that. And that's, again, one of the things that we're going to want to see what percent of people develop fever after the vaccine? What was the height of that fever? They said, well, after the vaccine, nobody got fevers of over 100, and now you have a fever of 102. We might think it's something different. And we deal with this all the time in pediatrics, right? Because kids come into the office and they're maybe well on that day. They get vaccines the next day, have a fever. And we always have to sort of distinguish, is this a fever from the vaccine or a fever from something else that was coming up? And that can sometimes be hard. So Casey says, assuming the vaccine is distributed to frontline workers in long-term care facilities, when will it be available to the general public? That's a really good question, because you'd have to know how many people both want to get the vaccine and how many people and how much vaccine we'll get. So we don't really know about how much vaccine we're going to get. We do know that there's probably about 4,000 healthcare workers, each who need 2 doses in Douglas County. Those frontline healthcare workers would be about 2/3 of the people at the hospital. They would be people who work at clinics, as I do, EMTs and others. We think there are about 4,000 of those. So we would need 8,000 doses or so in Douglas County to get all of them vaccinated. I'm not sure when we'll get to 8,000 doses, because that would suggest for us to get to 8,000 doses, the state would need to get to about 300,000 or 400,000 doses. So we don't really know about that. Gail says, in general, would those with lupus or immunocompromised from whatever reason be able to get the vaccine? Again, we do not know that until the data comes out. So I do not know, and I don't think the data is out there, whether people with lupus or those who are immunocompromised were in the study or control group. If they weren't in the study or control group, I think the recommendation would be they shouldn't get the vaccine until we have some data on people who have lupus or immunocompromised. One of the areas we really worry about is, for example, people who have like organ transplants. They're obviously really at risk from the disease, but should they get the vaccine? And we won't know that until those have been studied. So Jackie says, how will we be able to sign up to get the vaccine? Again, unknown. Some states are already starting to have sign-ups, Oregon not. So we're going to need to figure out how people can sign up to get the vaccine. Again, we don't know lots of the details on this. We think the original vaccine is going to go to 3 separate areas, that there is going to be a distribution network that will go to nursing home staff and workers. There's going to be a distribution network that will go to hospitals and hospital workers. And then there's another one which will come through public health, which will immunize other essential workers. And so I think that's what's going to happen. So if you have tested positive and had symptoms that didn't require you to be hospitalized, should you get the vaccine as soon as possible? Russell asks. I do not think so. Because we think the vaccine is going to take several weeks at least to go ahead and give any protection. So we don't think that which is called post-exposure vaccination is going to work for this virus. Now, post-exposure vaccination does work for 4 different diseases we know about. So if you get exposed to measles and haven't had a measles vaccine, if you get the measles vaccine within a short time after exposure, it'll prevent you from getting the measles. Same with the chicken pox, same with hepatitis B, and same with hepatitis A. We do not think it's going to work on this. It has not been studied, obviously, in this group, so I don't think so. But again, those are the kinds of things that the FDA does in its emergency use authorization, and ACIP, which is the Conference on Immunization Practices, actually tells us, don't give it to somebody who's got lupus, don't give it to somebody who's sick, don't give it to somebody who has a positive COVID test. If you've been part of the vaccine trials, this is what you should do. So vaccines very typically have really, really, really strict guidelines. They're made for, as we used to say in the Navy, they're made for sailors. Very simple. They tell you what to do. They have a book that answers all the questions on dealing with this. This is what we've got to get for COVID, because if it's unclear about the person with lupus, if it's unclear about what happens if you had the disease in July, it's just going to cause so much heartache. So they need to be explicit, and we'll follow the rules. So Christy says, we've had symptoms but can't get in to get tested until next Tuesday. Symptoms started this Tuesday. Should we still get tested? Yes, you should get tested. Seems funny. We did testing today. I think the urgent cares and the clinics are doing testing over the weekend. But still, next week would be fine. You should definitely still stay home until your symptoms are better and your test results are back. So Debbie says, are personal support workers who have been on the front line seen as priority for the vaccine? I'd love to know. Again, that's the kind of clarity we need. So when we talk about the first line being direct workers, great. I mean, I think I could probably say that a nurse who works in the ED, by everybody's definition, would be a frontline worker. But if you're a support worker for one person, are you frontline or are you second category or third? If you're caring for your mom, right? So you're caring for your 93-year-old mom, are you doing it? Now, very clearly, we would think you should get the vaccine so you don't give it to your mom. Those are the kinds of things that we just need to figure out. And just tell me. I mean, nobody's going to be happy with all the answers. People say this person should have been higher or lower or whatever. We're at a time now where we're needing to make decisions rapidly. Just tell us what to do and we will do it. The reason I was a little out of breath when I got here is I was having a call with one of the other health administrators, and they're very, very, very worried that our lack of clarity is going to lead to fighting about who should or who shouldn't get the vaccine, and I really want to avoid that. So Linda says, will the vaccine be mandatory or optional for healthcare workers? I think it's clearly going to be optional. Early on, we're going to have far more people wanting the vaccine than we have vaccine. It makes no sense to give the vaccine to somebody who doesn't want it, while there are people who want it who can't get it. So I don't see this ever becoming mandatory for healthcare workers. And the good news is everybody doesn't need to get vaccinated. Certainly if everybody got vaccinated, it would make the disease go away quicker. But as long as about 3/4 of the people get vaccinated, it's going to dwindle and die. And we're not going to have enough vaccine to get 3/4 of the population until probably the end of 2021. So again, I don't want to get into the big argument of making some people get the vaccine. So we'll see what happens at that. And remember, with all vaccines, no vaccine is 100%. And since no vaccine is 100%, even if you get the vaccine, we can't guarantee that you're immune. So at least until the disease is still around a lot, we're still going to need to do the distancing and the wearing the masks. So we'll get to that question on the type. So one of the new things that came out is the CDC has talked about shortening the length of quarantine. So quarantine now is 2 weeks, and there's no way to test yourself out of quarantine. Those of us who've carefully looked at the data says, well, that's awfully conservative, right? The incubation period is usually 5 or 6 days. By 11, 12, 13, or 14 days, it's really unlikely that you'll get the disease. And if you have a negative test at 7 or 8 days and are asymptomatic at 7 or 8 days, your chance of getting it in days 9 through 14 is really low. So could we make a shorter quarantine period with a negative test at 7 or 8 days? And the CDC has generally said no. But I think they're now beginning to say, well, maybe. So hopefully their guidance will come out that would allow us to do that, because that would be great. So Mary says, why get tested if you have to quarantine yourself until the vaccine is available? Well, we would like people who are symptomatic to get tested to know where the disease is. Because if we know that you've been infected, it helps us in 2 ways. One is we try and figure out who you might have gotten it from so we can find that outbreak. So most of these big outbreaks we have found before we've had the second amount of cases. So in the Halloween party, we knew about those cases early on. We knew where they were. And then we focused on the people who were at that party. That's called reverse contact tracing, and that's a good reason to get tested. The other thing is that we go forward contact tracing. We find the people you've been in contact with, and then we ask them to quarantine. So if you just basically quarantine yourself, that's good for you, but it doesn't help us figure out where you got it from or who you might have gotten it to. Could you tell us exactly where in the country the most active cases are. Country or county? Country. So there's a lot of places in the country where the most active cases are. My go-to source is the New York Times COVID page. They have this map that goes from white, where there are no cases, very few places, no places in the country, from light yellow through orange, through red, through dark red, through almost black. And that is down by the county level, exactly where the cases are. Oh, so, sorry, in the county. So can I tell exactly where in the county most of the active cases are? They are everywhere. So I will run through a group of cities where we've had cases in the last 2 weeks. Tiller, Days Creek, Kenyonville, Riddle, Glendale, Wolf Creek, even though it's sort of right at the edge, Kenyonville, Riddle, Myrtle Creek, Winston, Roseburg, Glide, Sutherland, Oakland, Yoncalla, Drain, Elkton, Camas Valley, Reedsport, Scottsburg, and Gardner. It really is all of those places. You know, the biggest outbreaks now are the most number of cases, Colonial and Roseburg, but that's where most of the population is. Still very active in the Reedsport area, very active in the Riddle area, very active in the Kenyonville area. So I don't know how that helps at all to know. There's just a lot of disease around, and since people in Glide shop in Roseburg and people in Kenyonville go to Riddle and people in Riddle go to Myrtle Creek and whatever else, knowing specifically what they are, it doesn't really help. So could we also break down the number of recovered? So again, recovered, you'll have to see if you'll go to our press release. There's a complicated discussion about recovered. You know, in most cases, the end of your isolation period is the end of your symptoms, and then you consider yourself to be recovered. This is clearly not that way, because there are some people who are asymptomatic, and it's hard to say you're recovered when you never had symptoms at all. We know there are people who are symptomatic for months, well after their isolation period. And because of that, recovered is such a problematic thing that we in Oregon and we in Douglas County are not really recording the numbers of recovered. How many in isolation, how many in quarantine? That is in our Facebook. It's not in our Facebook. It is in the county press release. And you can, and I would encourage everybody to sign up for the county press release. We'll put that in our thing. The county press release is truly a work of art. It comes out every single day, weekends, holidays, every day. We're working to put together the data, and Tamara or others at the county are working to put out all of this data you've wanted. So the number in isolation, the number in quarantine, the number of confirmed cases, the number of presumptive cases, the number of the people in the hospital, all that is there in a lovely chart. So we'll get you signed up for that newsletter. Actually, the newsletter is remarkable. It's got an incredible number of people signed up for it, and that would be the source of that. Recovered, again, it'll tell you in there why we don't do recovered. Because if you say somebody, if you pick a time to be recovery, a week, 2 weeks, 4 weeks, 6 weeks, you are saying some people are recovered while they're still quite sick. And then if you pick 4 or 6 weeks or 3.5 weeks, the person is asymptomatic, is clearly no longer infectious and has no symptoms. It is weird to say that they're still active 3.5 weeks out. So we've gotten rid of the recovered thing. The people in isolation are the people who are still potentially contagious, and the number of people in quarantine are their contacts, and we report that each and every day. So a couple of other things. So we talked about the CDC changing the guidelines for quarantine. That would be great because it'll shorten the amount of quarantine. It's also then going to be a real incentive for people to get tested. A couple of things that came out. There was a study in Europe that suggested that wearing masks didn't really decrease your risk of getting the disease. It was underpowered, meaning there weren't really enough people in the study to figure it out. It showed a slight improvement, but we again think that the real benefit of wearing masks is to prevent me from giving it to you, may prevent a little bit of me getting it from you. And since there was no way to tell if the people around the people were wearing masks, it was really hard to figure out. Can never go a day without a hydroxychloroquine. There's going to be a new study coming out on hydroxychloroquine. I actually saw the preview of it back in October. it was sort of a retrospective case where they looked at people, and the people who got COVID who had hydroxychloroquine seemed to have lower rates of progression of disease. However, it was in no way controlled, and there was no way to tell just what that meant. All right. Any more questions? We're coming right up to the Ducks game here, and I'm sure there's a lot of people watching the Ducks game, so that's a good thing. So if there are no more questions, we'll call it a night. We'll do this again on Tuesday. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer. A couple of things. Stay safe. We have another couple of days on this holiday weekend. Really be careful about, as we talked about before, the number one thing I would ask is gatherings with people outside your family when you don't wear masks. So that is at break at work. That is at a luncheon with somebody else. That is at somebody comes over your house to drop off a pie. And so, my daughter came yesterday to pick up some pies. We limited the length of that exposure, limited the distance on those. We were far apart from her. And that's the number one thing you could do. I think wearing a mask in the grocery store, clearly important. I think staying home when you're sick, clearly important. But the number one thing we're seeing is people in gatherings with people outside their family at a time they're not wearing masks because they're at church, because they're having a dinner, because they're having a party, or because they feel like, well, this is grandma, how could she be sick? So those are the times we're seeing it. So please don't do that. Please don't get sick. I'm really, really worried about this next week, because if we do see an explosion of cases related to Thanksgiving, those are going to be really, really, really hard to get under control. And typically when you see a big explosion of cases, it lasts 3 or 4 weeks. And if it lasts 3 or 4 weeks, that's going to be right into the Christmas holiday. And I was really, really, really hoping that for Christmas, what I got, in addition to my spit tests, was a time would be relatively free of COVID. So be safe, be kind, and we'll talk again on Tuesday. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer in Douglas County. Thank you.